the way that the healthcare workforce has rallied to deal with this ongoing and dreadful pandemic. So that as clinicians, I think there's a sense of, even pride, something very, very deep and positive on the as professionals, but on the human experiential side, it's very, very, very difficult. You've listed some of the stresses. I hear a lot from young parents, families that have two workers, as kids are going back to school one way or another, either virtually or really. The stresses on families are phenomenally large. The stresses fall, of course, unequally on people of disadvantage, people, the lower income people in the healthcare workforce, as well as in society at large. And I hear a ton about that. I spoke to a colleague recently, a person of color, who said she knows 32 people who have died of COVID time since the epidemic began. 32 people on her Facebook network. This is really, really erosive. There's something Tate comment on. I think we're in a kind of second wave of stress. I'm hearing exhaustion now. More and more people saying, how long will this go on? And the initial kind of punch of the stress, which was serious, now has on top of it this chronic erosive quality that I really resonate with. In fact, I can see it. I can feel it. This is now it's in a way normalized. It's part of our lives but it's erosive. And I think we're going to need new coping strategies for what I think is going to be a longer haul of this kind of stress. That's some of the background. We haven't even begun to talk about other nations and what's going on in countries less wealthy than the U.S. where economies are afflicted. And that's the last point I'll make is the economic impact. Of course, the impact that grips us most is the burden of illness and a disability, but our economies are taking an increasingly serious hit. A recent study just this week from the Harvard Chan School of Public Health and the Robert Wood Johnson Foundation found that over 50% of families in 4 large American metropolitan areas say they're under serious financial stress now, consequent on the COVID pandemic. So we're still in the middle of it.